There are few more frightening words to hear than these: heart failure. But those words don't have to be a death sentence. According to cardiologist Dr. Catherine Follick, heart failure can be managed, and patients play an important role. Dr. Follick is part of the Heart and Vascular Center at Metro Health and an assistant professor at Case Western Reserve University. Welcome to the show.
Thank you very much.
For this real important topic. Now, tell me, how is heart failure different than a heart attack?
So heart failure is a condition. A heart attack occurs all of a sudden. 1 minute you're not having a heart attack, the next minute you are. Heart attack can lead to heart failure, but usually heart failure comes more slowly and gets worse as it goes along.
Are there factors that contribute to it?
Absolutely. There are many factors. The most common is actual coronary artery disease, so blockages in the arteries that feed the heart. Other conditions, high blood pressure, diabetes, sometimes poisons like alcohol, like too much alcohol, and some actually medications that we use. One of the risks is the development of heart failure.
Okay. So if we didn't have a heart attack, how would we know that we might be having heart failure?
So at first, a lot of the symptoms are not really specific. Fatigue, a little bit of shortness of breath, a little bit of leg swelling. A lot of people think that they're just getting older. But if these are persistent signs, then they really need to go to the doctor and see what the problem is.
Okay. If you've got the symptoms, you're going to your doctor, what kind of treatments are available for heart failure?
Well, that's one of the great things about heart failure treatment now. And the term heart failure came from a time quite a while ago when there was nothing you could do, and where a diagnosis of heart failure meant that you really weren't going to be around for very long.
It really meant failure.
Right. Whereas now, a patient can have heart failure when they first present to you, and then we can actually sometimes cure the heart failure, other times we can manage it well.
Okay. And it's a lot of self-care by the patient?
Right. Well, at first it's medicines. Usually when the patient doesn't feel well, we need to figure out what medicines to use. Everybody needs a little bit of a different concoction, and that's why you need a heart failure specialist.
Okay.
That sounds a little funny.
With your brew,
yes,
huh?
we do tinker. We
Okay.
do so we have general guidelines, but one of the very fun things about treating heart failure is that you can make little changes that can make a dramatic difference.
Oh, all right.
And you mentioned self-care. Heart failure is a team approach. The patient, the nurses, the dietitian, the pharmacist, and the doctor all have an equally important role to play.
All right. So that's important now. So what if the medications don't work? You know, is there a next step up then in treatment?
Yeah, medications tend to work, at least at first, in about 80% of patients. We follow patients very carefully. If we see any signs that things are going in the wrong direction, we try again to find a different kind of medication that's going to work. But we do have mechanical options now.
Okay.
We have the heart pump that Vice President Cheney had used for 20 months before he had a heart transplant. And then we have heart transplants too.
Okay.
Clearly drastic things, but they really change a patient's life and can increase survival.
But really early detection and treatment can lead to good results?
Yes, and can lead to not needing those drastic measures ever.
So people can have a normal life, or a semi-normal life at least, and it doesn't mean failure
Yeah.
like it did in the old days.
One of the most dramatic things that we do, and that's just so fulfilling, is that we can have patients who can't even walk to the bathroom without shortness of breath. And again, this doesn't happen with everybody, but sometimes in 2 months' time, they're back to work, they're walking a mile, they're playing with their grandchildren.
That's fantastic. So, failure to treat and manage heart failure can have devastating consequences. To find out more about your options, use the information that's coming up next. My thanks to Dr. Follick for joining us today.
For your free copy of the Metro Health Heart and Vascular Center Excellence Report, which includes more information about heart failure, call 216-778-1614. Next, when your spouse goes to a nursing home, does his income go with him?